It must be amazing to help a couple who thinks maybe there's no chance to have a child.
It is. It's truly amazing to sit with a couple who, for whatever reason, has been told or has decided that their hopes are slim or non-existent. And what's so great about reproductive medicine today is it's come such a long way, even in the short years that Karen's experienced, that success is achievable for the vast majority of people, and technologies have become very effective and actually rather simple.
Now, in vitro fertilization is what worked for Karen. Is that the most common procedure?
In fact, though it's the most effective, it's one of the less common procedures. About 80% of the patients with whom we work successfully don't need to go to IVF. And I think that's a really important thing for people to know, that when you go to a fertility specialist, 8 or 9 out of 10 times we can figure things out and get it done pretty simply, without all of the things that we see on TV and the dramatic and more interventional things.
I think that's interesting for patients to know, because I think very often they assume by going there you immediately start with the hormone injections and the in vitro.
And that's not true.
Oh, wow. Yeah. Tell us about, you mentioned a couple of procedures that have really come a long way.
That's true. When you think about in vitro, for the patients who do need it, there have been 2 rather very dramatic advances in the last 10 years that have helped more and more people. One of them has to do with the way the eggs are fertilized in our in vitro lab. Intracytoplasmic sperm injection.
Okay, you're calling it ICSI, or ICSI, and this is an animation of it, isn't it?
It sure is. The embryologist is injecting one sperm directly into the egg, rather than use the more conventional techniques which we've traditionally relied upon to achieve fertilization. So with ICSI, men with actually very, very low sperm counts who through no other means would ever achieve fertilization or pregnancy can be very assured that fertilization will occur probably 90% of the time.
That is amazing.
Very exciting.
One sperm.
That's all it takes.
I've heard this quote before. It only takes one sperm. I'm like, that is ridiculous. It's unbelievable. And what's the other procedure you wanted us to know about? PGD.
PGD stands for pre-implantation genetic diagnosis, and the embryologists in our lab can sample a cell from an embryo by gently and safely teasing the cell from the embryo itself and then performing truly genetic testing on the embryo. So for couples who frequently miscarry because the embryos aren't genetically normal, this is great. Or for couples who have babies who have genetic problems, who may wish to do everything possible to prevent another baby from being born with that same genetic problem. This form of in vitro fertilization that we do is called PGD, can give a high level of certainty that when the pregnancy occurs, that having been pre-screened before it was placed into the uterus, that you're not dealing with the types of genetic problems that have plagued couples in the past.
And then not dealing with that difficult decision on whether to continue the pregnancy.
Exactly. Not finding out at 4 or 5 months that something's wrong.
We've got to break here, but I just want to briefly ask you, the Science Times on Tuesday talked a bit about how there are more birth defects than expected with in vitro.
We're still looking at that data very carefully, and it is controversial. There will be, using certain advanced techniques like ICSI, when applied to men, for example, a small percentage of men whose sperm itself is abnormal due to their own genetic disorders that lead to the pregnancies that would not have ever occurred and do, in fact, in that small subset of men, introduce risk.
So patients ought to ask you about that as well. I think
that's one of many discussions we have.
Responsibility to ask all those questions.
And ours to answer.
Very good. Thank you so much, Dr. Michael Doyle, and he's a fertility expert in our area.